everyone. Welcome to the Zone to Speak podcast. I'm your host, Juliana. Hey, everyone. At Zone to Speak, I know how important it is to stay healthy, strong, and ready for every ride, workout, or adventure. That's why I have gotten some exclusive discounts on products designed for athletes. First up, Cyclists. Their Smart Pump is a game changer. Compact, efficient, and perfect for keeping your tires road and gravel ready. Get 10% off the Smart Pump and 5% off everything else at cyclists.com. They have radar tail light, smart fans, trainers, and more. Next, 35% off Frey Skincare. Their products are specially designed for skin that sweats, perfect for athletes like you and me. I have personally been using Frey for many years and I love it. Then there is 10% off Cold Age. Their vitamins and supplements are designed to fuel your body, helping you recover faster and ride longer. I personally take the women's vitamin and creatine. Finally, 15% off Omra supplements. Whether you're training, recovering, or pushing for peak performance, their high-quality supplements have got you covered. And there's something special from me, your host. As an integrative health, nutrition, and sports nutrition coach, I am thrilled to offer all of our listeners 25% off personalized nutrition coaching with Genki Wellness. If you want to optimize your health, boost performance, or simply feel your best, head to bemoregenki.com and use the code ZONE2SPEAK. For everything else, head to the links in the episode description, use the code ZONE2SPEAK at checkout, and let these amazing products support you and your journey to better health and performance. And now for the episode. Welcome to another episode of Zone to Speak. Today we have Dr. William Murrell, who is an innovator sports medicine orthopedic surgeon disrupting global health care to deliver a world full of happy, healed, and healthy people. With a passion for helping athletes and active individuals, Dr. Murrell specializes in regenerative medicine, focusing on innovative treatments like PRP and stem cell therapy to accelerate recovery and optimize joint and muscle health. His innovative work spans from the US, UK, Middle East, and Germany, where he has designed and operated state-of-the-art facilities. A sought-after clinician, educator, and researcher, Dr. Murrell co-founded and serves as co-editor-in-chief of the Biologic Orthopedic Journal and is an associate editor for the Journal of Orthopedic Surgery Research. Dr. Murrell has worked with an elite and professional athletes, including top men's and women's tennis players from around the world. Dr. Murrell, welcome to the podcast.
Oh, well, thank you very much, Juliana. It's a great pleasure to be with you today.
Thank you. So, as you know, the podcast is about the world of cycling, and within any sport, there are always injury and hopefully injury prevention. So I was wondering if you can share with us a little bit of the common injuries of cycling and how can we maintain great health while cycling?
Got it. I think you can divide the injuries that we see in cycling into really two categories. One category is an injury due to a crash or a fall or traumatic injury. And the other injuries are mainly surrounding your health and wellness and your fitness. And, sometimes if you're on really long rides, centuries plus, you're drinking a lot of water without electrolytes, this can sometimes cause problems. And the problems really can be quite wide. Simple things like dehydration, but also you can get electrolyte imbalances, and these imbalances can change your mental status. And with that, you can go to the first category because you're not really thinking clearly, and then you can crash, uh, and then you're in the first traumatic category. But uh, largely, these are the two injuries. Yeah,
Wow. So the lack of electrolytes or the opposite of too many electrolytes or some imbalance also causes some lack of
mental clarity.
mental
We
clarity.
Yes, and so for probably the most common, especially if you're on a really long ride, is you drink a lot of water that doesn't have, very much sodium in it, for example. And hyponatremia is something that we see in sports, not only in cycling, but many sports. And what happens with hyponatremia is that um, you can really lose your mental focus, and you can be quite what we call uptunded, and this means that you're not really yourself, and you're not really thinking clearly. And um, so there are probably some really good sources of how much electrolyte should be included in your fluids that you're intaking, especially over a very long ride. But my thoughts are, probably every 1 out of 8 uh, units of fluid that you're intaking should have some good electrolytes. And I think with this, and also eating well after your rides in the evening, if you're, say, riding all day, I think, and having enough salt intake in particular, I think this can really help you. But then you have the other side of that where you're taking fluids like, I don't want to say Gatorade because, Gatorade is not the most healthy of fluids, but, this particular product has lots of solutes in it, including glucose, and in some countries, high fructose corn syrup, which is will really absorb a lot of your body's fluids or water into the gut, and then you can become really dehydrated. And so you have kind of two. It's a fine balance, and you have two sides of the coin uh, that you really need to watch out for. And but I think the most common problem that we see is really just not having enough mineral or solutes in your water, and then you can crash. And so,
Okay.
um,
So it's better to have the electrolytes, obviously, than to not have any, because then I guess you're just flushing your body and
yes,
you just deplete yourself from the electrolytes, minerals that you need.
especially if you're on a very long ride.
Yeah.
And
We have a lot of ultra cyclists that come to the podcast and listeners, and I myself ultra cyclist, so we do a lot of long hours on the bike. So that's
yes,
super important because I thought maybe the mental clarity was just being tired.
yes, well, it could just be because of being tired. But if you are drinking, uh, you know, 10 camelbacks over a period of a day, and one of these or more are not one with electrolytes, because, you lose salt when you're riding. And, sometimes, especially on a very hot day, you can even see the salt on your skin.
Yeah.
Um, and so yeah, so taking adequate electrolytes is super, super important. And I would say probably about 1 in 8. So if you drink 8 camelbacks, I think one of them should be one with a salt electrolyte mixture. and and then also just that night, just eating well, and with a wide variety of foods, and And then the other piece is adding to that. The other piece is, it's really great to take whole foods and you know, including fruits and eating things that are unprocessed. And this is another issue because we like to, as cyclists, like to take in some processed things. Some of these bars are very heavy, and they're heavy in solutes, and and they may replenish your energy or the 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 gels, for example. They're heavy in solutes, and if we're in this case, if you're not taking enough water, then it can kind of have the other effect where you kind of dehydrate, and then you can have um, your muscle function and endurance can diminish as well. So
Yeah.
um,
And
yeah,
digestive
so,
issues, I have them. Because I usually do eat very well, very wholesome, but if I'm on a race and I only find packaged goods, I'm eating those. After a while, I start having, some stomach pain and stuff.
yeah.
Yeah.
So, but uh, but cycling. I used to be. I wasn't really a tour or a road biker. I was more into mountain biking, and some days it would be 40 or 50 miles off road, which is pretty significant.
Yeah.
Um, but we would see a lot more traumatic injuries, and but the great thing about cycling is that most of the time these injuries are pretty easy to recover as compared to, sports like football or rugby. Um, you see more upper extremity injuries, for example, because we fall on the outstretched hand or you fall on your shoulder, fracture your collarbone. But really, the sometimes a proximal humerus fracture, but really the injuries are not as severe as we see with contact sports, for example.
Okay.
So
And
yeah.
how can, with your experience in regenerative medicine, how can these innovative treatments like PRP and stem cell therapy help speed up the recovery, while promoting long-term joint and muscle health for those type of
Uh,
injuries?
well, uh, first of all, we could just talk about what these therapies are. Basically, regenerative medicine is a discipline where we use products that we make from your own tissue or blood to make um, medicines that you create that help to heal or accelerate damaged or degenerated tissue. And we also use it for augmentation of conventional orthopedic interventions. Say, for example, if someone had a clavicle fracture, we could make a um, adjuvant treatment that is rich in both growth factors and cells that promote healing. And we could add this to the surgical construct to allow for more quick and more thorough healing um, uh, for treatment. The other big area, of which is probably not as common in cyclists, are treating joints that are degenerated. Say, for example, knee is probably the most common. But again, cyclists probably have a much lower incidence unless they had some other injury from another sport for developing a degenerative joint, especially of the knee. We have some examples of athletes that have developed hip arthritis. There's some Tour de France winners that had hip OA. But this is very, very common. But basically, we use these therapies to either augment conventional orthopedic procedures or we use them to treat primary problems. Probably for cycling, the most common things that we treat are tendinopathies. So, for example, the Achilles or the patellar tendon or the quadricep or the hip abductors. These are uh, probably more common uh, conditions that we treat.
And do you
Yeah.
think, like for the hip, for example, do you think it's a lack of stretching and mobility, or not just that? Because I
Um,
know we get very tight, usually as cyclists, because you're in that position for a long time, just pedaling. And a lot of cyclists lose a lot of mobility if you're not constantly doing some flexibility work.
well, I think that flexibility work is super important, both for your mind as well as your body, especially as you get older. Um, I think that when we're younger, it's a lot easier for us to jump on the bike and just knock out 150, 200 miles and get off and then drinks a couple beers and have a good time. But as you get older, these behaviors really don't serve the cyclist. And but I also think that it doesn't really serve us as people either, because we tend to get a bit more stiff as we get older. And so important to keep the flexibility, but probably even more important is to, activate all of our muscles with an adequate warm up before we start. And uh, I think this helps with improving performance, um, and also helps us to kind of maintain our performance when we're riding.
All
And
right. Something I
yeah,
never
but
do, so I need to start doing it.
yes, everybody, well, it's a habit, and it's just not, uh, uh, it's just like anything. What we focus on, what we think is most important, and what we actually do is what we're going to do. And so we have to be very intentful about, our actions and what we want for ourselves. And I think we're going to see in the next decade or so people living a lot longer and a lot more active. I mean, look at you. I mean, you're super active, and it's only going to get better with time. And
Hope so.
yeah, we will see people living a lot longer. Finally, someone has broken the 123 barrier. And so we will start seeing people live a lot longer, even 150 years. And so,
Wow.
with that, maintaining our flexibility, this helps our mind as well as our body. And maintaining our flexibility is super important. And you just have to just make it a habit. And I know it's difficult when we're busy, because we're trying to fit our activities into our available time. But this is super, super important for our longevity while we're cycling.
Yeah, absolutely. You treated me on during my triathlete days for my knee, and I had the PRP injections and everything, and I feel much better. And I definitely don't want to start having problems with cycling. So I have incorporated a lot of what you told me, and I feel like I did become a better athlete, but I haven't been doing the warm up. So everyone, write it down and let's start doing our warm ups, activating those muscles before going on a ride. And I don't think it takes a lot, right? What do you need? 5, 10 minutes for a warm
Yes,
up?
if that. Yeah, if that. It's super, super important, because you don't develop abnormal uh, functional patterns in muscle activation. When you warm up, then you're ready to go, and it has a huge impact on your function. And
Yeah.
some people need more warm up than others, and it depends on what you're doing too. And so, like say, for example, for a triathlete, um, to get the best performance, and the swim is first, you really need to, you may need to warm up 800 meters before your swim so
Yeah.
that so that your muscles are ready and you can perform at your peak and optimum level. Yeah. Some people need that, really. Yeah.
Yeah, no,
So,
absolutely. I feel, especially on the long distance, I don't have any explosive power in me. And I always
yes.
joke, but it's true. Like only after 50 kilometers there I start to feel good,
Yes.
on riding my bike. I can't just jump on the bike and have
And
perfect
go.
form and go. Yeah. Yeah.
Yeah. Yeah.
So maybe I was missing also as well this warm up.
Yeah.
I'll try
It's
that.
super important. And it also decreases the risk of injury too. Because if you try to push too fast before the muscles are actually functioning and you have not maximized your joint displacements or range of motion of your joints, you're hobbling yourself. And so you can't call on that explosion, but you could train for that, Juliana. If you know if you want to have some more explosive uh, power, this is something that you can introduce to your training. And I'm not a training expert, but I know this is very intentful. If you want that, you have to develop that in your training, and I think it's possible. Yeah,
Yeah, 100%. I agree with that
yeah,
too. I'm always trying to build the endurance, and forget a little bit about the explosive, but I'm definitely adding to my routine the warm ups
yes.
because I think the injury prevention, it's for me is more important than performance, especially that I'm turning 50 in 2025, so
You don't look
I
it. You
thank
look
you.
you look like you're 30. You're turning
Oh my
30.
gosh, I'm gonna start blushing. Please stop. Uh, so tell me a little bit more about what type of um, treatments are part of, like, what else besides PRP? Because PRP, I know it's like the plasma injections. Like you said, you take your blood, you process, get the plasma, and then inject in the injured area to help reactivate the healing or accelerate the healing.
Well, we should look at these kinds of therapies and other orthobiologics and other regenerative medicine treatments. They're sort of like a signal. They're they're used as a signaling device to stimulate your body cells that are already present in that area, in that general region, to focus on healing a particular problem. And there are other therapies out there. There's a lot of buzz around the use of other orthobiologics or regenerative medicine treatments like exosomes, stem cells, for example, conditioned serums. Um, and I am super excited, and I super support the development of these kinds of therapies. However, uh, I am a scientist at heart, and it's important for me that we use these things responsibly. And if someone comes to me for a particular treatment for a particular problem, I don't want to just experiment on people unless we actually have a study going on. And you know that we've done lots of studies, even in Dubai, since 2010. Um, so I like to use therapies that actually have some evidence for the condition we're treating. And the problems with the use of things like exosomes, for example, there's a lot of buzz around that. In some of the peptide treatments, both oral as well as injectable, is that there has not been a lot of research done
Mm.
to validate these treatments, but they're being offered. in Dubai, I mean, it's very, I don't want to say the Wild West, but there is a lot of treatments available. And, we have to be super careful. And most of these things I totally support. Like, for example, for exosomes, I think it's super wise. And I think that it's the future of what we're doing. And I'll tell you why. I think that exosomes, which are basically extracellular vesicles, it's sort of like the waste product when you are culturing cells, for use. And Dubai has one of the few places in the world that allows autologous, or means cells from you, to be cultured and expanded. And
Okay.
it's one of the few places in the world that allows it, and it's legal, and it has
Wow.
good safety and relatively good efficacy. We need to do more studies, but we have some good scientific support to use them. And so the waste product that is made when you're culturing cells are these extracellular vesicles, or exosomes. And what's great about them is that uh, you can make them with great intent, and they're very customizable. And that means that you can add very defined levels of these proteins called cytokines and chemokines. You can add certain DNAs and messenger RNAs, uh, and these vesicles do not require receptors, so they can fuse with our cells that are healing or trying to regenerate without a receptor. And so that's super, super powerful. But it's
Wow.
also, we need to be very, very careful, in my mind. And the issue that I have with these therapies is that we don't have a lot of evidence. And we don't have a lot of evidence because the funding required to do the research is just not there. And the pharmaceutical companies, they like to sell us all of their medicines.
Of course.
Um, and there is very, very little support. And this is why most of the time we are not doing the studies, and we're kind of just using them on patients because we assume that they're safe. But I can say that there are very, very few studies in the area of musculoskeletal medicine that have been done. But I just want to tell you, I super support it, and I do think it's the future. However, I think for me, I am really not comfortable giving it to patients at this time because there's just not a lot of research. But
Yeah, I
hopefully I can be
understand.
one. Yeah, hopefully I can be one of these people that do the studies. I would hope so. So
And how does it work with exosome? Is that like an injectable? Doesn't require surgery.
that is
You just
correct.
you just put it in the area that needs healing,
Yes, you can
that it's
put
injured.
them into joints. You can put them into soft tissue. You can give them intrathecally. That means inside of um, below the covering over the nerve uh, in the spine, for example. You can also give them in the epidural space. Say, for example, you have a disc problem, and it's a space above the covering where the dura, where the nerves are. Um, you can also give them IV. You can
Wow.
give them on the intravenous side, and you can give them on the intra-arterial side as well. And so, and like I mentioned, the great thing about them is that they can easily make their way into damaged cells. And um, so I think it's a very powerful possibility for the future. However, at this time, I am just not super comfortable with it. And it's the same with peptides, for example. And these peptides, They are purported to help with recovery, improve function, improve endurance, improve your capabilities as an athlete. However, there are very, very few studies done. And there are some for neurodegenerative conditions like Alzheimer's that seem to be very compelling. And they appear to be very, very safe. And they're not regulated because they're seen as supplements at the moment. But these are very, very powerful uh, substances that can actually affect change in your body, both on a metabolic level as well as a structural level. And so, um, and these are available in UAE, both injectable as well as oral tablets. Yeah.
Wow.
And
It's a shame about the pharmaceutical industry that they just want to sell medication and they have the power to hold all these studies, but that's another podcast. And and I really hope this gets to be studied because, like you said, it is the future and it could be revolutionary.
oh, for sure. I have no question about it. And some of the other areas that we've been studying lately, I was with a group utilizing a treatment for the spine called Decil, and it uses something very simple. It's a fibrin glue to uh, uh, heal the outer layer of the discs. And cyclists do have back problems. And we did a study with more than 5 years follow up and about over 900 patients. And it seems to work really good. Uh, Number one, we do a procedure called a annulogram, where we diagnose these tears in the outer covering of the disc called the annulus fibrosis. And then we use this fibrin glue, which is like a biological glue made. You can make fibrin glue from your platelets as well. Um,
Okay.
and you inject that area of the disc, and it works really well. And it has long standing healing. And as I mentioned, we did this in over 900 patients and um, um, over 5 years follow up. And we even used it on some people that had already had surgery too, with very good results. And the results were so good that in the United States, the Department of Defense has mandated that this treatment be utilized first before any uh, uh, fusion or disc procedure, unless there's some sort of large neurologic compromise, that before fusion, that this treatment be done before fusion, because it's a single treatment and it's far, far less invasive.
Wow, that's
Yeah.
very powerful. Yeah, I was gonna ask, like, for cyclists dealing with chronic issues like knee or lower back problems, how can regenerative medicine provide viable alternative to surgery? Because surgery has progressed a lot, but it's still a very scary word
Yeah.
for a lot of people.
Well, we have some other platforms that a different class of regenerative medicine treatment. One in particular is called, it's a conditioned serum. This is the category of treatment. And basically, how we make conditioned serum, we take your blood, we incubate the blood for a 24-hour period, and then we make an injectate from that. And we administer it over a period of 10 to 6 weeks, depending on your condition. And it also works very well for the spine. And we've published some work for the spine, both cervical as well as the lumbar spine. Secondarily, it probably works the best for tendinopathies or uh, degenerative conditions. Well, tendinopathies are not really degenerative, but for the sake of this podcast, I'll just say
Yeah.
that they're degenerative. They're probably just a lack of healing. Too much stress overwhelms your body's capability to heal that tissue. And so it probably works second best for these. The one that I have done the most research, we've done probably 6 studies on it. It's called Goldic, and Goldic stands for gold-induced cytokines. And it works wonderful for a person that has a sort of overuse or tendinopathic injury, and for the foot and ankle. If someone has pressure on the nerve, like say someone has a Morton's neuroma from their foot, this is a common problem that you see in cyclists. You have your really tight shoes with the cleats, and you see Morton's neuromas in cyclists. It works really, really well for this, and it's a very potent anti-inflammatory, but it also has impact even above the area of cytokines. It actually has the ability to turn off some inflammatory pathways at a um, um, uh, epigenetic level.
Wow.
So it's a very, very the main protein is called gelsolin, and it's a very potent epigenetic protein, but it also has impact at the um, transcriptional level. And transcriptional level is where your messenger RNA uh, is translated into proteins, and these proteins can be inflammatory proteins, and so it has an impact there. And so it works very well for tendinopathic conditions, and we have very good evidence to support its use. To say it uses gold to stimulate your body's white blood cells to make a certain myriad of proteins that are very important for healing and regeneration. And we believe that it actually regenerates some tissue. Yeah.
And these treatments, I guess, you have no downtime. You can just continue with regular life. And how many treatments would you need to start seeing results?
So for say, for instance, for the condition serum, it's the standard protocol. The company comes from Germany. Uh, uh, the standard protocol for say intratendinous injections is a treatment of 4 injections over a period of 10 days to 6 weeks. And sometimes people are available for treatment, and sometimes they're not because of life. And um, so it really depends on the person. But you can have the treatments every other day until all 4 injections are completed, or it could be the manufacturer recommends that they're done every third day. So this would take approximately 14 days with the incubation, or 15 days with the incubation, to get all the injections done. So yeah. So um, but no, they're very good treatments, and they're designed as a single treatment. It's not something that needs to be topped off.
That's really good.
Some of the regenerative pharmaceutical agents that we use, um, say for joints, say hyaluronic acid, these things are designed to redose. They're kind of aligned with how the pharmaceutical industry works, and that is just, maintenance of disease versus healing or regeneration of disease.
Got it.
So
Yeah, I had the hyaluronic injections back in the day. Um, and I don't know if you know the answer to this, but because a lot of these are still very new, is this something that most insurance cover, or we have to pay out of pocket?
I think for certain things, I think they are covered. And I think them being covered will become more prevalent in the future. We have sufficient evidence, say, for example, for PRP. I think we have sufficient evidence to prove that it works. And in the United States, we have what they call temporary codes. So I think for PRP, it's already approved for use in any Department of Defense facility. It's been approved since maybe 2005. And also our Veterans Administration facilities has also been approved since about 2012. And so, and for the general population, there's now a temporary code. And so I think probably within the next 5 years that PRP will be an acceptable treatment. But for some of these other things, Decil is covered on the military side, but not in the general public. So it may be some time. There's no temporary code for the treatment. For stem cells, this is a whole nother thing. I think that we have a lot of evidence. Doing autologous treatments or using your own cells, I think is very expensive and maybe not worth the effort. But I think probably in the future, if we are using cells, which are a bit more complicated and a bit more unpredictable as compared to using, say, something like exosomes, you can predict a bit better with exosomes. I think that we are most likely to use allogenic cells or cells from someone else for these treatments. I think it will come, but I don't think it's going to be your own cells. It'll probably be someone else's cells. And there are a number of approved products that are allogenic in nature for different conditions. Like, say, for example, if you had a kidney transplant, because there is a host response versus the graft, which we usually use medicines that suppress the immune system. I think in the future, you'll have things like a cellular-based product that will be used instead of, say, these immunosuppressives. You'll get, the cellular preparation that will modulate your immune system so that you accept the organ. And a number of these medicines have already been approved.
Yeah, that's good. It would be great if those type of treatments are more and more accessible to people, because a lot of times they might be expensive for out of pocket, but for an insurance company, it's probably more financially making sense than actually surgery.
Yes, yes and no. My thoughts about all of this is that I personally despise insurance. And
you're not alone.
Yeah,
But we
and
need, a lot of people need and count with health insurance.
well, if we look at where we're coming from and what we have available, I think that we live in an existence or universe or multiverse, if you will, of abundance. And basically all the resources that we need for anything that we want to do is available to us. And we have to align our thinking and our behavior and our actions and our intents with that. And, we're so gifted and talented. And with the future of AI, robots, and I think humanity itself will be a lot more free to do what we're really great at doing, and that's being creative. And I think that us working 9-to-5 jobs to be able to sustain what we're doing, I think that will be a thing of the past. And I think we will see this in our lifetime, that we will have a great abundance And this is aligned with my vision to heal the world, and where everybody has access to everything that they need. And then we're free to be the creative beings that we are. And so, yeah.
Beautiful. I love that. I love the vision. I agree with you. And I really hope you're right about us seeing this in this lifetime. I think a lot of things are already shifting, especially in the
Yes.
9 to 5 world.
Yeah. You
Yeah.
know, I mean, we're not here to be slaves to the system. And to me, insurance and jobs and all this crap is just lending itself to this slavery to the system.
Yeah.
And
It's
I
noise
think,
to the abundance
yeah,
that it's coming.
yes.
Yeah.
And, and so we have everything that we need, and we have great abundance. And, and I hope that, this is reflected in my life and what you see that my wife and I are up to, my soulmate and I are up to, because we are living examples of abundance and, living a life that is um, just so worth living and not
Absolutely.
being a slave to the system.
Yeah.
We are
Yeah.
not designed to just work. We are creative beings, and we can create, and we can create anything. Anything is possible. Yeah.
Amen to that.
Yes.
Love, love, love. And if we go back to injury prevention, just to summarize, we talked about hydration, proper hydration, warm ups, flexibility. Anything else we might have missed that you want to add to it?
Well, yeah, we can add one other thing, because before you even get on the bicycle and when you're training and, before a competition, um, uh, I don't know if you knew this about me, but I have been a vegan since 1990.
Yeah,
And so I think it's super important to, what you put into your temple is, to me, very, very important. And I think there is some thoughts, especially in the athletic world, that, you know, eating a plant-based um, diet, does not give an athlete all of the requirements needed for, peak performance. And so that is just not true. And um, eating a well-rounded, whole food-based, plant-based diet can really provide everything. Enough protein for sure, and we see examples of it. In the area of bodybuilding and powerlifting, for endurance athletes, in the Olympics, for example. And I think it also is important to give ourselves fuel that not only is good for us, but also good for the environment, good for other beings on the planet. And um, yeah, you know,
I am very happy you touched in this because I'm a vegetarian. I'm not vegan. I still eat eggs um, for compassionate and environmental reasons. And today, but I stopped eating meat, or I never started eating meat. I don't even remember. My mom just told me you just didn't want to. And I'm not a preacher to people around me. If you want to eat a steak, go for it. But I also like to educate others that, because a lot of people ask, but how do you get your protein? And I'm so happy that more and more athletes, this past Olympics, there were so many vegan athletes getting medals and participating in the games, and just to be there, it's quite a journey. So I think those are great, great examples that eating wholesome you can get all the nutrients you need. You don't need to be eating animals, and there's nothing wrong with it if you do it, I guess. I don't know. It's hard to say. Don't want to judge, but obviously I'm against the industry. But it's achievable. You don't
Yes.
you
Yes,
don't
there are
need to eat animals.
13. Yes, there are 13 complete proteins that are come from the plant kingdom, and they're super nutritious. And I used to have a chronic inflammatory condition, which really made me be a bit more strict on what I brought into my temple. And I think it's really helpful for weight control if you're having issues with that. Um, I also think that environmentally, it leads to an environment where we can all thrive versus the animal industry versus harvesting all the fish from the sea. And you know, you get all the nutrients, you get all the protein you need. Let's just think about some of the other animals in the animal kingdom, like gorillas, for example. They don't eat any meat.
They are
Chimpanzees
vegetarian.
eat meat. They are
Yeah.
total vegetarians, and they're probably 4 times stronger than the strongest human. And uh, so you don't really need to eat meat. It's really a choice, in my opinion. And I'm not coming from a place of judgment, just like you. And have I eaten meat? Yes, I've eaten meat. And do I like it? Yeah, I like it. But to me, it's just, it's not the responsible long-term choice for our health and well-being for everybody, in my opinion.
100%. Likewise,
Yeah.
tastes good. I taste it. I like it, but it
Yeah.
doesn't make me feel good, in my heart eating
Yeah.
that and also in my body. So I
Yes.
choose not to, but in summary, have a good and balanced nutrition. It's super
Yes.
important to fuel your body right.
Yes, that's right. You'll live longer and you'll perform longer and be more active in your life without all the toxins. And that's another point we didn't talk about, about detoxifying. And I think this has to be done with great intent. And but maybe that's a whole nother conversation, as you alluded to other topics. Um, and so, maybe there could be another time that we chat.
I would love that. I would love to have you back because there's just so much and that we can unpack. And I would love also to get some feedback once we have, this episode out to see, how people react, what else they would like to know. But I know your time is super valuable and I really appreciate you sharing this hour with us.
Well, it's been
It's
awesome.
great to see you. Yeah.
Same here. And I look forward to seeing you in Dubai uh, and maybe on the road somewhere. Maybe we could do some tour, all of us together
I would
somewhere on
love
the
to.
globe.
Would love
Yeah.
to. Love to
Yeah. You're
just
super inspiring.
oh, likewise, likewise. And
Yeah.
I would love to meet your super inspiring wife. So
Yes.
we need to try to make our schedules cross path somewhere in the world soon.
Sounds perfect. Sounds perfect.
Wonderful.
All
Thank you
righty.
so much. Have a good night and
Yeah.
chat with
Good
you.
night, Juliana.
Bye.
Okay. Good night.
And that's all for today's episode. I want to thank the listeners for tuning in. Your support means everything. If you enjoyed this episode, please consider following, leaving a review, and sharing it with your friends.